Good afternoon, everybody. My name's Scott McGann with the Falmouth Health Department, doing our every other week, roughly, FCTV presentation. Today's Monday, November 21st. This will be for data that ends on Thursday. I just had to be off Friday for something. So today is Monday the 21st, and this will be for last Friday's presentation. Our email is health@falmouthma.gov. If you want to call us, it's 508-495-7485. 5,741 PCR positive cases, 41 over the last time I gave you the presentation till today. So it's 11/3 was the presentation, so the data is from 11/4 to the 14th. 41 confirmed PCR cases. Again, I stopped it on the 14th. So we're averaging for the last month. I averaged what the last 4 weeks were. It's about 25-ish, 26 PCRs. Again, only PCR. There's a boatload more cases when you're looking at the home kits, the home tests. But if you're comparing apples to apples and you stick with the PCR, if it goes down, it goes down. That means it's going down with home kits. And our positivities got cut roughly by 15 down to 8 in the last couple of weeks, and where positivity was sitting around 9, 10, it's down around 5. So there's definitely been a drop in PCR, which would tell you there's also a drop in home kits. And so that's where I'd say what this is. This does tell us, I'm sure there's a ratio that doesn't change all that much. So a drop in PCR tests, which is what we know, would give us an overall indication of a drop in home kits. The other way to do it is hospitalizations. We are low. Don't look at the bottom. I forgot to change that. We are low. We're down a little bit in admissions per 100,000, and also a little bit down in inpatient beds used, and definitely down in cases per 100,000. So the county is, in the entire state is green. So we are definitely in a downward trend. You can see that this is hospitalizations in Barnstable County, because it's a good indicator, because it doesn't really matter what kind of test you get if you end up in the hospital. So hospitalizations are looking week to week, since the home kits are probably the best way to look at it, and they are. And you see over the last few weeks that there's been a downward trend, which is great coming into the holidays. So reason to, with everybody getting together and going to see, especially if you hadn't done it for a couple of years, and, your relatives are getting older and we haven't seen each other for a while, we're definitely going to be doing it at some point. So you'll see more travel. You'll probably see an increase just because more people getting together. But to start at a lower rate and have somewhat of an increase, most likely from the holidays, as opposed to having a high rate going into it, it's obviously better to have the low rate. And so that's good. Positivity, this is incidence rate, 8.8 for the time period of the 30th to the 12th, 30th of October to the 12th of November. We're on the middle range to maybe a little bit below average, above average in performance, below average in rate from our peers, which is good. And also incidence rate is definitely dropped. Percent positivity has definitely dropped down with Barnstable, Bourne, Provincetown higher. Things go up and there's an ebb and flow to this, but we're amongst what we're doing amongst our peers in this county. We're doing pretty good. We've done pretty well over the last couple of weeks. That time frame, the 30th to the 12th. Last time I did this was 6,600. Now we're 4,400 PCR cases throughout the state. That's a good sign. Things are down. Things remain down in our trends. With the vaccine, the deaths never really got up. And then the testing rate is dipped. Cases are dipping, and hospitalizations are flat to a downward decline with a little bit of an uptick that happened about a month or so ago. Wastewater, another indicator. So looking for signs of COVID in wastewater. This is the MWRA with the north system, the North Shore being in green, and the South Shore being in orange, brownish orange. There's definitely very similar, and it's on the lower end from when the data started, with that line that goes off the chart in the far left being the original Omicron high case counts we had a year ago in January of 2022 into a little bit into February. That drove right back, went way down, and then you start seeing this meandering, but not at a high rate. So it's on the lower end. Booster shots, again, bivalent booster is out there. We checked on Friday. There was a fair amount of open spots if you go on to VaxFinder. Hopefully they fit into your schedule. So you need to think about your second booster, or what booster you're at. But if it's been at least 2 months, the next booster you should get is the bivalent. And so, schedule yourself for that. Go on vaxfinder.mass.gov. There are appointments. Children under 3 really should go through the pediatricians. Most of these places will say 5, or some will say 6 months. But for the most part, if you got a young child, you'd want to be going through your pediatrician first and taking their guidance. Otherwise, the rest of us go on vaxfinder.mass.gov. It's still the place to go. Still plenty of testing available. There's home kits, and the pharmacies and so forth still have some testing. As far as our vaccinations, 1,097 doses were administered between the 1st and the 14th of this month. About a quarter of us have gotten a second booster. That number showed 8,700. Though I think some of these that show up with 1 dose and second dose shots that show up with 91 and 101, I think there's a fair amount of those that are actually first doses, and maybe the data is just person doesn't remember, or it's a new card, they don't have a card, they didn't tell the person giving it. Some of these actually might be, because I think these last couple of numbers have been a little high for new vaccines. I think some of these are actually boosters. But anyway, it doesn't matter. 1,000, 1,100 shots given out in a 2 weeks time frame to Falmouth residents is a good number, regardless of whether they fall into the category correctly or not. As far as variants go, there's a rainbow of variants right now, quite a few of them. Some are taking off. If you go up and look at this maroon-colored one, the 2.75, it's kind of like, looked like it was increasing, then it fizzled out. Some have just gained traction, like the BQ1, BF7, and the BQ 1.1. Those are definitely doing better than, let's say, the 4.6 that never really took off, and it's starting to outcompete the BA5. This is just the way it's going to happen. They're all Omicron-based. They don't generally reproduce well in the lungs. You don't get the COVID pneumonia to the same extent. And people are vaccinated by and large, a lot of us, so it's not resulting in the hospitalizations, and that's why we're in the green. But again, it's one of those things. It's gotten to where we thought it would get, and we're here. So this change in variants, it seems like something that's just going to continue on for quite some time. So as a recap, county's low. Things are all trending lower. There's plenty of vaccine and testing capability. There's plenty of home kits available. I just gave the senior center a bunch, so there's plenty around. BA5 is the dominant. There's some others, I guess, some other entities as well that we did some bulk order for. Bivalent boosters is what you need to get. BA5 is the dominant, but other variants around and starting to gain traction. There's no change in the guidance, and I don't see any changes in the guidance. So that's the update for today, and we'll keep on doing these every couple of weeks. And hopefully, with the holiday, everybody have a good Thanksgiving. And with the holiday season coming up, then we started at a low, should help us, and we'll see what happens. Thanks.